Hi, I'm Dr. Faranak Kamangar, and welcome to the Future of Dermatology podcast. We're here to talk about the real science behind skin, the medical breakthroughs, the cosmetic innovations, and everything in between. Hi, we are back. I'm so excited for today's episode. We have Soroush Aboutalebi, and this is really exciting. So we met serendipitously outside of the derm world, in the business world, and we started chatting a few months ago, and he starts telling me about, as you know, we're dermatologists, we start talking about dermatology immediately, and he starts telling me about his skin journey, and we lead to his history of going to actually Camp Wonder for decades. And this was right before a San Francisco Derm Society meeting. And we were doing the whole fundraiser there for Camp Wonder. And then one of our members was actually going to volunteer there. It was just such a cool combination of things when we started sharing stories. And this story has to be told on the podcast. So welcome, Soroush. Thank you so much for taking the time.
Yeah. Thanks, Doc. Thanks for having me. Excited to be here.
Yes, so excited about your story. If you feel comfortable, I would love to just start with your story and your skin journey and tell us as little or as much about everything.
Yeah. So I was born with a genetic skin condition. It's called CIE, and you obviously know what that means, but stands for congenital ichthyosiform erythroderma. And I describe it as just like it manifests almost like a permanent sunburn, if you will. Dry skin, gets a little red, and so it's got some lengthy upkeep. And so I was born with it. It's genetic. My brother has it as well. He's much older than me. But I've been managing it my whole life, and it's definitely a part of who I am. And at this point, I think it's a strength because it really makes me unique. And so, it was a little challenging growing up, I will say. Looking different is challenging, and children can be harsh sometimes, and they'll latch on to anything that they can kind of poke fun at. So maybe led to some issues growing up just socially, but nowadays, again, I think it's my strength.
No, that's amazing. And I got to say, meeting you, without you having said that, I wouldn't have even known, which means you have learned over the years how to just take impeccable care of your skin. So I'd love to hear about that. Like or maybe starting back, like at what ages did you start thinking, okay, I need to do X, Y, and Z? What things did dermatologists tell you that were actually helpful? Or did you have to find that information out, kind of on your own? Because a lot of times these diagnoses are given, but maybe not with a whole lot of information about, well, but there's all the stuff you can do with it to keep your skin looking great and not having the sequelae. So I just love to hear your journey with that. Like, was that like you just went to the right place and they gave you all the right info, or was it a bit of journey? Like you mentioned, kids for noticing things at a younger age. So I'd love to just kind of hear your journey of like what it goes through to kind of figure out how to maintain your skincare.
Yeah. So, I mean, I'm very lucky. I've got an incredible family. And like I mentioned, my brother has the condition as well. And he was born overseas, elsewhere. And the diagnosis itself is very rare. And when he was born in the early 80s, I'm not sure that any physicians in the hospital where he was born even knew what it was. So his initial treatments were literally rubbing like olive oil onto his skin to keep it from drying out. And then eventually they kind of iterated and his situation improved. So when they moved here to the US, they actually moved to the Bay Area, which is where I still live. And they were, trying to figure out his treatment plan. And then they got matched up with a dermatologist from UCSF. I think her name was Dr. Mary Williams. And she had formulated the initial compounding medication, the first prescription of the topical cream that gave my brother relief. So I definitely walked in his footsteps. They sort of were able to figure out his care plan as he kind of grew up in America. And it was this old compounded medication of like acid mantle and aquaphor and tretinoin and a bunch of other constituents. And we used it all the way until, I was grown up and whatnot. So that prehistoric prescription still carried over. And so, had my brother as a good precedent on what to do to care for my skin. And it, I had a lot of help from my parents. Like they would help me with my care well into like, I mean, almost like into like adolescence. So, 10, 11, 12, they would help me and whatnot. Our diagnosis requires like a lot of exfoliation of the skin and moisturizing on top of that. So the treatment back then is the same treatment as right now, in that it's cycles of exfoliation and then super moisturizers on top. Um, I think in about 2015, an interesting thing happened where I don't know if it was an insurance related charge or if it was something else that happened with just my healthcare. The pharmacies that we would go to would no longer do compounding. So we were left to just go and resort to other super moisturizers. And so we use Aquaphor. You can get it over the counter and it's, at a reasonable cost. So now that's like my primary super moisturizer, if you will. And so over the years, personally, like I've done my own version of my treatment plan. Like I think I have sort of dialed it in what I need to do to look my best and feel my best and to improve certain things, whether it's like dandruff or dry skin or rosiness. I've kind of thought of like solutions for all of that. And we can get into it. But one of the things I love about Camp Wonder is that I'm able to share that, 3 decades of like practice with some of my campers who may not have been told kind of some of these tricks and hacks, if you will. So that leading to their quality of life improvement from just a little bit of information from me is one of the most special things that I witness when I'm involved with camp.
That's incredible. Thank you so much for sharing your story. It's so helpful for patients and dermatologists. And you make a really good point. The art of compounding has been lost over the years. I don't quite know why either. I presume there is, regulation costs and things like that that have maybe made it harder, but you don't see as many compound pharmacies. And when you do, they kind of compound very like maybe straightforward things for, let's say, toenail fungus or pigmentation of the face, things that like are going to be large orders because I guess they're ordering things in batch. But when you kind of look at like a one patient that has this very unique thing that works for them, maybe it's not cost effective, per se, to like create those things. So you're actually bringing up a huge gap within dermatology because it didn't used to cost this much to compound things. I mean, doctors would even do it in their clinics. Like that was like a whole thing that
Wow.
derms, did back in the day. So, I mean, I think you're totally bringing up something that I'm going to talk to my colleagues too. That is an area of, because the straightforward things over the counter are not always made for everyone. So then you have to kind of go on your own journey to get to figure this out. I think it's very early in this field, but there are some companies that are now, like there was one at our last meeting where they're making these, really advanced topicals that are delivering so I'm probably not explaining it right, but some sort of just genetic changes or specific molecules to the skin specific for certain conditions. Again, that's another thing because it's, large pharmaceuticals target larger, things. So when you're looking at cases that are smaller, and your end population is just a smaller amount, that might happen. The research and development might happen less, but it's incredible that technology exists now to be able to kind of like deliver the exact protein that the skin needs to then be able to kind of create all the moisture and everything and the skin barrier itself. So really just exciting to see where this world goes. But we do need to look back and just say, well, why did we lose things that worked before? Like the compounding. For example, I'd be curious actually too, because we can get into camp, which is what I'm really excited to talk about as well. But I'd be curious, since kids are coming from all over the country, if you're kind of hearing that same story. Like we know what, because Bay Area, I practice in the Bay Area, and I do think it's hard to find compounding. I wonder if that's the same case for all over, if that's a California thing. But yeah, so let's chat about camp too. When did that story start for you?
Yeah. So I can't tell my story with camp until I can tell the broader camp story. So Camp Wonder was founded and in 2001 by Francesca Tanconi. So she is our founder and still our director, and she's our fearless leader. So when she was 16 years old, she founded the organization. Her family was based in the Bay Area as well. And, she was also somebody who was afflicted by skin disease and as a kid. And so she, being an incredible leader, galvanized a bunch of support from her friends and family, got some funding, and basically began this camp for children. And initially, it was very small. It's always been it was historically located in Livermore, California. Camp Wonder is a 1-week long medically staffed camp for children, campers with chronic skin conditions. There are counselors who are in cabins with the kids. It is an overnight camp, and it is just a ton of fun. So while there is very high acuity in the conditions of the campers, it is not a sad place. A lot of our campers are effectively patients for 51 weeks out of the year. And this is the 1 week. Camp is the 1 week where they just get to be kids. So it's a lot of fun. And through the years, camp has grown and evolved. And now we actually have camp in Georgia at a new facility. But until 2021, we were in Livermore. So I was initially involved with Camp Wonder. 2005 was my first year. I was about 10 years old, and I was a very wild, rambunctious kid in the middle boys cabin. And it was just like a love affair right away. I felt seen. I felt like people understood me. And I've, to this day, some of my best friends and people who I consider family are from there. So it started, and then I kind of was a camper for a number of years. And then when I hit like 17 years old, I was able to become a counselor. It was very convenient for me because my family's from the East Bay area, and it was just a short drive to Livermore. But we have campers from all over the country, and folks from Canada and other parts of the world as well. So it's been really special. I was a counselor for a number of years as well. And now I'm a little bit more on like the leadership, administrative side of things, now that we're in Georgia. But it's really great. And what I've found has been the best effect for me personally is that through the years, it really like developed my confidence, because you do have a lot of social, like psychosocial issues that are surrounding skin disease. It's a very visual condition. And, for me, the most challenging thing is that folks would come up to me and think that like I have a sunburn, or that I'm neglectful because I didn't wear sunscreen or anything like that. And, that hurts because I'm very deliberate about my skincare, and I'm very serious about it, and I'm not neglectful at all. I'm quite the opposite. So camp allowed me to develop that confidence to know that while people may say things, like, I know the truth and things are going to be fine. So really good for perspective, for developing my maturity. I think camp is really wonderful for the other campers for the same reason. Not only is it a wonderful place where they get to see their friends and whatnot, but they see people who are afflicted by the same challenges as they are, and being able to relate on that level is amazing. So that's kind of where we're at now. It happens every year, usually in June. It's been growing. We have an incredible community. We just celebrated our 25th anniversary last summer, had a party and whatnot, but truly the best organization I've ever been a part of.
That's amazing. And the longevity of it, 25 years. That's incredible. And you've been with it many years now, since you were 10 years old. That's really that is commitment, right? Like thinking back, what have I kept up since I was 10 years old? That's incredible to be committed to that level. And it's just so amazing when you're sharing the stories. I mean, we have a good concept in dermatology that, when people leave outside of our office, there is all this stuff that they're dealing with. But, in a 10-minute visit and a 15-minute visit, you might not have time to absorb all of that. So it's just so important to be reminded of. It really is, it's like a conscious thing, right? That you have to think about, like, not only the care of your skin. And it's interesting, you say, people would say, oh, you didn't put enough sunscreen. And you're probably thinking, well, if you only knew how much time I spent doing things like skincare. And then also on the other hand, skincare means very different things in different circles. And for kiddos in this circle, I mean, skincare can be life and death, right? If your skin is not intact, if you get an infection, you mentioned some of the acuity that happens. And it's incredible that you have physicians, right? And how important is it that the dermatologists come to camp, do you think?
Yeah, so I think it's absolutely vital that we have dermatologists on site. We are able to recreate any type of advanced clinical setting that any of our campers have back at home. We have 3 medical directors who have been with the organization for a very long time. They come every year, and they sort of run the show. And then so they sort of oversee the operation. We've got a cadre of nurses, not just derm nurses, but nurses from kind of different specialties who have been involved for a very long time, who really like toe the line and make sure everything's going really well in our infirmary. We call it the med shed. So that's what we call our little clinic on site. And then we have residents that come from our partner hospitals every year. And we have medical students as well. So the residents are dermatologists, the medical directors are primarily dermatologists, and then we have like nurses that kind of come from all over, and then medical students as well. So kind of all the different ranks. And then in addition to that, we have a bunch of, donors and sponsors that come from like pharma, if you will, or some of these other companies. And everybody kind of comes and chips in. So the value that I think that it brings to medical students, nurses, residents, the director level physicians is, it's not super common to see a lot of these diagnoses like in person and be able to spend a really long time with the patients. You're able to see epidermolysis bullosa like in person. You're able to see the camper like interact with their environment, with their friends. You see them eat, you see them do dressing changes, you see them get into the water. So you're able to really observe them over a long period of time. I'm not sure you're able to get that kind of exposure in other settings in the same way, at least not surrounded by other folks. So, especially for medical students where you might see maybe like a paragraph or two, like in some textbook about what a certain diagnosis is, I think it's really invaluable if you're interested in dermatology to see it in real life. And you're able to ask questions in a very casual, non-clinical setting if you need. So I think that's pretty cool. And then not just that, but for folks like me and others, like it gives us access to the providers and the physicians and the doctors and the nurses that I may not get. Like, you and I are friends, but I'm not necessarily able to spend an hour and a half with a dermatologist whenever I want, if I want to pick their brain about something that I'm thinking about treatment wise. Whereas over there, I can just sit down at the doctor's table and we can have lunch and we can talk about whatever we want, treatment or otherwise. So I think there's great value for folks that are doing healthcare to see it. And in addition to that, it's a ton of fun.
No, it sounds great. I mean, that's the way you explain it. You're right. Like we should have all derm residents rotate through clinic at some point because these are rare conditions. You might not ever see it if ever. And if you do, it's less than a handful, I'm sure, of each condition that you might see. And we know even in our clinics, the common things we see, let's say like an eczema or psoriasis, even those conditions, I mean, you see hundreds of them. And after like the first few hundred, you're like, oh, I learned this. I mean, learning from volume is something you can't replace. And then, like you mentioned, outside of that 10 to 15 minute doctor visit, having that longevity of like the conversation and learnings is so invaluable. So, and then like, let's say you're a provider, med student, resident, what are the best ways to get involved? Is it just to email, go on the website, email, and or do you have any thoughts about how people can kind of get more involved if they want to?
Yeah. So we're always looking for additional medical staff. It's always, a group at camp that we're trying to, bring in. So our website, csdf.org, is the best place to look, and there's contact info there. And, we've got some people that can reach out to coordinate all that. We do have some partner hospitals that bring their residents over. They cycle 3 in at the beginning of the week, 3 at the end kind of thing. So that's kind of like the most intense level of involvement, where the organization is sending in professionals and we're kind of doing a formal exchange. That's a really great way. Right now we have USC, UCLA, Navy Med, a couple other hospitals are really involved and have been for a while. And there's a whole application process and a vetting process. So it's very drawn out and it's very selective. But we are always looking for more people. So you'll find all the information on the website, and I'm happy to kind of be a connector. If anybody wants to know more, I'm happy to provide my info to talk. But I think it's a really special opportunity that, like you said, I think all of our residents should do. One more thing is like, I think you get some unicorns at camp where it's like, you might see psoriasis and eczema all the time, like you mentioned, but have you seen like somebody in their mid 30s with Harlequin ichthyosis who's been through all those like hoops, and it's an amazing situation that they're here and they're thriving, and seeing those stories is special. It's very much the human side of the patient care that you get at camp. And I think that's really powerful.
Absolutely. And just having that anecdote, and let's say you have a new patient just diagnosed in clinic, and you could tell them, well, don't worry, I just saw a 30-year-old last week at camp and they're doing great and they're working in this and they have a life. I mean, it's amazing for people to hear that at any stage. I'm sure, new diagnosis is always hard. Midway too, all sorts of challenges come out. I'm sure during teenagers, there's all sorts of things that, so at every stage, it's so great to have that human connection, and the stories I feel like are incredible. I mean, that's the one thing that many fields are missing is that like inter-patient, interpersonal, just story sharing, and like, it's going to be okay. You're going to be fine, and you'll figure this out. But that's fantastic. And just hearing that, I didn't hear any of our like Northern California residencies listed there. So that's also on my to-do list. Maybe to reach out to, our usual residents with SF Derma, UC Davis, UCSF, and Stanford. We'd be curious to see if any of those residents are interested. Maybe that's something SF Derm can help them with as well, with just helping them get out to camp and things like that. I mean, that would be an amazing experience. So thank you so much for kind of sharing the route of how that could come to life if residents want to come. Outside of that, let's say a dermatologist is listening, loving the concept, can't physically come. Are donations, things like that, still helpful? I mean, I presume, because I think a lot of this is paid for by camp. So
Yeah. So I should say camp is totally free for everybody who attends. We even handle airfare. So we try to put as minimal, as little of a burden on the families as possible. They've obviously got their hands full. So that's something that the organization's very proud to provide. So yeah, we're always, I think giving is something that we really embrace. We did a giving campaign last year, right in the lead up to camp. And, it's probably the best way to help without actually being there in person on site. So we're always accepting that. And we're always eternally grateful for our sponsors and our donors. Information for that is also available on the website. And another thing is, I would say, like, if you are a dermatologist or somebody that works in the field listening, like, one of the best ways that I think you can make an impact that doesn't require much at all is, if you see patients that you feel are having some, social, issues that result from their illness or otherwise, like bringing or letting them know about camp is a huge, huge thing you can do. All they have to do is they check out the website, they submit an application when the time comes in spring, and, you go through the process. So I think that's like the easiest low hanging fruit. But obviously you can give and you can come and visit with your time and provide all those other options too.
That's a great point too. And we'll leave the link below as well. That's probably the most important thing. As you're finding these patients, just direct them to this amazing resource that exists and has existed for such a long time. So if we don't tell patients about it, it's a true disservice. But thank you so much for sharing all this. And also at the end, we always have to ask, since it's the Future of Dermatology podcast, what are you most excited about for the future?
Yeah. So, what I'm most excited about is for the potential of treatments and potentially cures for conditions and diagnoses that you haven't really had breakthroughs a lot. Ichthyosis is one of them. How are we going to ever get past the super moisturizer interventions? But seeing how in specific, like gene therapy and how that could potentially improve folks' condition, while they're still alive, would be really interesting and special. And you mentioned, there's different like solutions and compounds coming out to like that are kind of getting close, but seeing a real breakthrough would be nice. I think that's probably the number one thing, how the different gene therapies could could improve the treatment for some of our folks.
Absolutely. No, I definitely agree with you on that. And the amazing thing is once those pathways are found, which, they're looking at things like CAR T and different methods, even for like psoriasis patients, other conditions outside of derm. Once that pathway is kind of figured out of how to safely deliver genetic changes to someone, then it really comes down to splicing out the correct gene and putting it in there. So I'm so excited for just the future of medicine in general. I feel like that's one of those things that I'm like, can we stop everything else and put all resources on this like tomorrow? I don't know why those things keep having little hurdles and 2 steps forward, 5 steps back, but it is getting there. Science is still pushing forward, regardless of all sorts of different things that happen around it. But I mean, that true interventions like that are going to be incredible. And in the meantime, of course, we will have to figure out compounding and why that's still a thing. I mean, that's like at the very least, that should be like available. That's old technology. So I thank you so much for sharing everything. And hopefully we can also get you out to our SF Derm conference. Maybe the residents can actually even ask in person more about how to get involved in the experience. But thank you so much for taking the time.
No problem. Again, thank you for having me. It's been really fun.
Thanks for joining us today on the Future of Dermatology podcast. If you enjoyed learning about the science behind skin, make sure to subscribe and we'll see you next time. As a reminder, this podcast is for educational purposes only, not for medical advice. Always consult your healthcare provider.